Have you ever stopped to think about how your mind affects your lung or how your lungs affect your mind? For millions living with chronic respiratory conditions like COPD, asthma, or long COVID, the connection between mental and lung health is real and largely invisible. Hey there, I'm Dr. Devi Sundar, and in my channel, I talk about lung and mental health. Today, in this episode, I'm going to deep dive into a shocking reality revealed from the new survey. 7 in 10 UK adults don't realize that struggling to breathe physically often comes with an invisible emotional burden. For years, I have been advocating for mental health support to be integrated into lung rehabilitation for people with chronic respiratory disease. Since 2021, I raised this issue in my channel. I talked about lung and mental health many times, and most of the weeks I was actually releasing 2 or 3 videos in the past, and now limited to 1 video a week, and also through my petitions, including a major one in UK Parliament in November 2024. I also launched a local petition in Gloucestershire last year, similar time in November 2024, and went a step further to speak directly with the local MP in 2025. In June 2025, I also wrote to the All-Party Parliamentary Group about this petition, which I raised to the UK Parliament, and to the Department of Health and Social Care to highlight the urgent need of integrated care for people with chronic respiratory disease, where their struggles of mental health and psychological injuries go unnoticed most of the time. Yet, despite these efforts, the matter is still on hold. Even my Breathe Better program, which I reformed and made it into a fully integrated care model, combining the physical and emotional support, still hasn't received the recognition or the support it deserves. So I decided to take action. As the founder of Tele-Therapies and Mind Body Synergy CIC, I commissioned a UK-wide survey with YouGov to understand the public awareness of mental health impacts of chronic respiratory disease. And the results are shocking from a sample of 2,173 responses from the UK adults. We asked a simple question: how aware are you that people with chronic respiratory disease are at increased risk of anxiety, depression, and social isolation? Only 31% recognize the connection of lung-mind health. That means nearly 7 out of 10 people, UK adults, are unaware of what I call emotional breathlessness, a silent, significant public health issue. And the survey revealed deep disparities, telling us awareness is particularly low among young adult age groups between 18 to 24 years, only 32% of them aware, and males only 28% aware, while the older age groups in the category of 55 plus, only 36% of them aware, and females, about 34% show comparatively higher awareness, highlighting a notable generational and gender gap in understanding the mind and lung health connection. Interestingly, our findings show among the working age group adults, only 14% are very aware, while 25% aren't aware at all, showing the urgent need for workplace health education. As the HSE occupational health reports show, there is an annual deaths of 4,000 from the group of chronic respiratory disease. And this is alarming. And a survey also explored the life experience, which matters too. Separated or divorced adults are most aware, 38%, and widowed adults, 33%, likely reflecting their personal illness or caregiving experience. And married adults, about 29% aware, and parents, 33% aware, which is falling into a moderate awareness category. Community and workplace initiatives, as well as bereavement and support groups, could serve as an effective outreach platform to create awareness of this mind-lung health connection. Now, let me talk about the geography, which matters too, which our survey went deep into. The survey revealed a wide regional variations. Awareness is highest in Wales with 37%, and Southwest 35%, and Northern Ireland 33%. And the lowest in the Southeast 27%, East of England 29%, and East 29%. Scotland, London, and Midland hovered around the national average of 31 to 32%. Even in regions with high chronic respiratory disease like Gloucestershire, Somerset, and Bristol, emotional breathlessness remains under-recognized. So what this tells us, our findings show a significant gap in public perception, which can delay the help-seeking and under-recognition of the psychological distress in people with chronic respiratory disease, where we also know from the neuroscience that psychological distress causes psychological injuries, which decreases our immunity levels and are fighting against the disease. So we are actually prolonging the disease, not producing a meaningful cure, and also raising the economic cost of the NHS, our nation, in serving people with chronic respiratory disease. And when we look into the real life of people with chronic respiratory disease, this lack of awareness has real consequences. Emotional breathlessness can intensify physical symptoms, reduce adherence to treatment, and delay help seeking, making life even harder for people already struggling to breathe. So how can we help? We urgently need public awareness campaign highlighting emotional breathlessness, psychological screening embedded in lung rehabilitation program across the nation, trauma-informed, culturally sensitive training for the clinicians who are dealing with chronic respiratory disease group. More importantly, funding and adoption of integrated care models for treating both mind and lung in groups of chronic respiratory disease in our respiratory care pathways in NHS and in private sectors. To support patients, caregivers, and clinicians, my recent book, Breath Beyond Illness, dives deeper into the emotional toll of chronic respiratory disease and explains the breath trauma loop linking the mind and the lungs. And it includes evidence-based insights, reflection prompts, and my PIPR model, that is psychosocially integrative pulmonary rehab for emotional and physical healing. Remember, breath sustains life. The mind and lungs are inseparable, communicating through breath and nervous system. Every patient's emotional and physical breathlessness deserves recognition and care. Integration of psychological support is not optional, it is necessity. If you or someone you know living with chronic lung condition, don't ignore the emotional side of breathing. Awareness, understanding, and integrated care can change lives. Let's start the conversation and give the emotional breathlessness the attention it deserves. Thanks for watching and staying with me until the end of this video. One favor if you can do to make a change is share this video with your group or networks to spread the message. Awareness is key for change. And do hit the subscribe button if you have not already. And if you felt this information informative, and if you wanted to show gratitude or appreciation for this survey, please also hit the gratitude button, that is the thanks button at this end of the screen. As usual, until my next video, stay curious and stay healthy. Signing off, Devi Sundar.